According to World Health Organization, headache disorders are among the most common disorders of the nervous system. It has been estimated that almost half of the adult population have had a headache at least once in a year. In India, roughly 1 in 4 to 1 in 8 persons suffers from one of the headache disorders, especially migraine. Not only is headache painful, but it is also disabling, and many people have reported to lost an academic or employment year due to disability caused by migraine. Headache disorders causes great deal of personal suffering, impair quality of life, and also cost financially. A person suffering from repeated headache attacks lives in constant fear of the next episode and may develop fear to the triggering factors that cause headaches. It sometimes can affect the family life, social life, and employment. To avoid extensive use of medication, individuals with headache disorders seek non-pharmacological treatments to reduce headache frequency and improve quality of life. Physiotherapy is one of the most effective treatments for headache and migraines, but its role is unknown to many. Hello, Namaste viewers. Welcome to our channel Physiohealer. Today's video is about understanding and differentiating various headache disorders and learn how exercise helps to keep your headaches away. International classification of headache disorders have classified headaches in two categories: primary and secondary headache. Secondary headaches are those that are caused by something else. Here, headaches can occur due to some injury or any vascular disease, brain tumor, substance abuse, high blood pressure, or the pain can radiate from the neck region known as cervicogenic headache. Primary headaches are migraine, tension headache, cluster headache, which is a part of condition called trigeminal automatic cephalgia, and other primary headaches such as cough headache, headache associated with exertion, sexual activities, and new daily persistent headache. Primary headaches are one of the most prevalent neurological disorders and can occur during a wide range of lifespan. Among primary headaches, migraine presents with a complex sequence of symptoms within every headache attacks, and the clinical presentation changes with age. Migraine occur usually at one side of the head, pain is throbbing type, and occur behind the eyes and below it. Pain may switch from one side to the other and last for 4 to 72 hours with complete pain-free episodes between attacks. The headache is associated with nausea, vomiting, sensitivity to light, sound, or smell. Here, the patient prefers to lie still in a dark and quiet room and avoid physical activity. Around 1/3 of patients perceives an aura, such as zigzag lines of light or sensory disturbance to one side that lasts for about 5 to 60 minutes. Migraine often is triggered by various factors like change in weather or hormonal change or certain food. Unlike episodic migraine, patients with chronic migraine are more likely to be unemployed, have relationship difficulties, and family problems. Tension type headache can be differentiated from migraine as it lacks the associated symptoms that accompany migraine, like presence of aura, nausea, vomiting are not present during tension headaches. Persons suffering from tension headache describe the pain like pressure in front and side of the head, that is around temporal and frontal area. The pain usually occurs on the both sides and it is not age dependent. Cluster headache, however, is described as more severe than migraine. Here, pain is excruciating and often described as suicidal headaches. The attacks last between 15 minutes and 3 hours, occurring from once every other day to up to 8 per day. During attacks, patient will be very agitated and sweat profusely. Unlike migraine, they will not be able to sit still at one place and they will keep pacing. Certain automatic features such as tearing of eyes and drooping of eyelid may accompany headaches. The pain can be so severe that the patient will pound their head with the fist and get relief. Cluster headache is more common in young men who smoke. The symptoms of headaches, especially migraine in children, are much different from adults. The attacks are shorter, pain is often not one-sided, and symptoms are unspecific, such as paroxysmal episodes of feeling unwell without any other reason for it. and some intolerance to light or reduced appetite. Tension type headache in children is often of mild intensity and does not aggravate due to physical activity. Symptom of cluster headache in children, although fewer compared to other types, found to have same presentation as adults. One type of secondary headaches that results due to habitual falls and poor posture is cervicogenic headache. It is a chronic headache that arises from upper neck, that is from atlanto-occipital and upper cervical joints. The atlantoaxial joint is made up of first cervical vertebra known as atlas, which is connected to the skull, and the second cervical vertebra known as axis. 60% of rotation movement of neck occurs around this joint. Any disc pathology or reduced range of motion around this joint sends pain signals via nerve roots C1 to C3 to head and neck. Such type of pain that originates at one point and felt at somewhere else is termed as referred pain. In this case, pain is felt in the head, jaw, forehead, ears and back of the eye. There are other symptoms like neck pain, stiffness in the morning, nausea, or sometimes vomiting may also occur. All these symptoms exacerbate by neck movement. Cervicogenic headache is more common at the age between 20 and 60 years, and common cause for such pathology is poor posture resulting from excessive screen time, slouched sitting and heavy weight lifting, or sometimes whiplash injuries. Patients with secondary headaches have red flags in their onset history that helps in diagnosis. A sudden exploding headache known as thunderclap that peaks within a minute suggests subarachnoid hemorrhage. Thunderclap headaches can also be a presenting feature of blood pressure drop within the brain or spasm of intracranial arteries. Similarly, headaches associated with fever, rash, reduced or altered consciousness level suggest central nervous system infection in conditions like meningitis or encephalitis. Research have proved that exercise could be an effective treatment in patients with primary headaches. Aerobic training has a small to moderate clinical effect on pain intensity and medication use on migraine patients. Strength training showed a moderate clinical effect on tension type headaches. Dry needling produces a soothing effect for short-term headache pain relief and improves intensity and frequency of pain in patients with tension type headaches. Sitting for prolonged periods in any posture can begin to cause discomfort, and there is a correlation between poor neck posture and tension type headaches. A forward head posture can cause muscle tightness and imbalance that can contribute to headaches. Physiotherapy can help to treat and prevent headaches by addressing the postural imbalance, providing strengthening program for the weaker muscles and stretch for tight muscles. Mobilization of joints can relieve stiffness, and massage of the soft tissue will release the tension. Regular aerobic exercise can help make migraine come less often and make them less severe. However, in many studies, exercise has been reported as a trigger factor for migraine. It has been established that a burst of intense activity in hot weather or other stressful conditions may lead to exertional headache rather than migraine, and the pain may go away as the body gets used to working out. The key benefit of regular exercise is that it relieves stress, which is often a trigger for migraines. Relaxation exercises with breathing helps to soothe migraine pain by relaxing taut muscles and improve circulation. Exercise such as rhythmic breathing, deep breathing, progressive muscle relaxation, mental imagery relaxation helps to create harmony between mind and body. Cognitive behavior therapy is a psychotherapy approach that helps to change thought patterns and behavior that can make a patient less tensed and lower the risk of migraine attacks. Do you get headaches after exercising and is afraid to start again? Here are some tips that can help your body to get accustomed to regular exercises. Hydrate yourself properly. You may trigger migraine if you don't have enough fluids in your system. The color of your urine can tell you the right amount of water you should drink. A darker color is a sign that you should drink more. You will know you are hydrated if it's light yellow or clear. Get some fuel. Exercise makes your blood sugar go down and cause migraine. Eat 1 to 4 hours before workout. Opt for complex carbohydrates and protein in your plate. Warm up and cool down. Start your exercise slowly, gradually increase the intensity and end slowly. This helps to regulate your heart rate and blood flow, as sudden burst can lead to migraine. Lastly, be careful of the environment you are exercising. Workout in heat can make you dehydrated and cause headaches. Stay tuned for further videos on headache disorders and learn various exercise techniques, psychotherapy approaches, diet recommendations to deal with your headaches. Share and like this video and subscribe to our channel to get more video updates from Physiohealer. See you next time. Bye-bye.